I'm Dr. Hansen, and today we're going to be talking about neurotoxins. You've heard them called Botox. Botox has kind of been a generic name, kind of like Kleenex is for facial tissues. So in reality, Botox is a very specific product made by a company called Allergan. But it was the first to be introduced, but then there has been multiple that have been introduced since then. There's been Xeomin, as well as Dysport, Daxxify, and Jeuveau. We primarily keep Dysport and Botox on board because we feel that they work the best for the vast majority of patients. The other ones, in my opinion, are a little bit of niche products. You may have heard about a more recent one that's supposed to last longer called Daxxify, but really Daxxify, in my opinion, does not appear to be lasting really any longer than the others, but it also does come at a significant cost. So we've really just managed to stick with the Botox and Dysport. Now, the only difference that we really feel for Botox and Dysport is that there's some light variation for certain patients. I would say 95% of patients actually can use Botox or Dysport interchangeably without having any complications from it. But Dysport actually has an advantage. One of it is that it kicks in just a little bit faster. And in theory, it lasts just a touch longer than Botox, but the studies really have shown that they're pretty similar in their length of stay for each patient. Now, there's also Botox, which is the general standard. One of the advantages to it is that it doesn't spread quite as far as Dysport. A lot of people are wondering, what are the areas that we can do with Botox? Everybody's heard about it for hyperhidrosis or excessive sweating. You can actually do it to the hands, the feet, and the armpits. It does get a little bit expensive, but it can be done. And in most cases, it's difficult to get insurance companies to pay for it. The primary areas that we do use it for, what's called the glabellum, or people will call it their 11s or their frown lines. And then we can use it for the muscles up here called the frontalis muscles. Those are the ones that raise our eyebrows. We can do injections out in the lateral eyebrow that actually help raise your eyebrows up when we do it, and we call that a brow lift. We can do your crow's feet. Believe it or not, we can actually do a little bit underneath your eyes, just if you really wrinkle that skin up there, and sometimes it can open the eyes just a little bit as well. We can do the bunny lines. Those are the lines that form on your nose over time, and that softens those up very nicely. We actually can do upper lip. We can do a gummy smile. So if you're one of those people that your gums really show when you smile, we can actually drop that just a little bit, really without affecting your smile. Also on top of that, we can do the muscles that kind of pull down. They're called the depressor anguli oris, and they actually pull down in the corners of your mouth. For some people, their mouth likes to turn down. That allows the mouth to actually raise up. And then we can even do the little bands down here called the platysmal bands. Those are the muscles. That's the muscle that does this. And we can actually relax that muscle, which quite often will relax that skin sagging. Another couple of odd areas to the lower face that a lot of clinics won't inject, or ones that we inject quite often. We're referred by dentists to have injections into patients' masseter. That's the big muscle back here. Sometimes it's for people with a little bit of TMJ, so they get headaches or they get chronic pain in their joints. But also for women, we can actually reshape their face a little bit, because if they got really prominent masseter muscles, the Botox or Dysport will actually cause a little bit of muscle atrophy in there without affecting their ability to chew. And what it does is it actually will shape their face and just give it more of that V shape. Now, another place that people often will notice is they get dimpling on their chin. A lot of women will complain about that. The chin will kind of tip itself back up. It gets little dents in it, and it's called peau d'orange. And what that means is basically orange peel-like. And so then by relaxing that can actually dip the chin so that it doesn't point up. But then on top of that, it can relax the muscle called the mentalis muscle, which actually causes that crimpling of the skin. So if you're interested in talking to us further about any of the neurotoxins, please give us a call at the clinic and you can set up a free consultation.